All right, good afternoon, everybody. My name is Ndola Prata, and I'm the Faculty Director for the Bixby Center for Population Health and Sustainability. Welcome to this presentation. Today, it's my pleasure to introduce you to Marcus Gay. Marcus, I've known Marcus for quite a while. He's such a passionate and hardworking young man with a lot of interest in assembling data and questioning sort of a very important issues, and in this case related to abortion. And so he will present to us today some of the work that he has been doing for quite some time. That is also part of his honors thesis. So
thank you so much for that
Marcus.
introduction, Dr. Prada. Can everyone see my screen okay?
Yes.
Awesome, thank you. Great, thank you so much for that wonderful introduction. As Dr. Prada mentioned, my name is Marcus Gay, and I'll be talking to you today about the research that I've been doing for my honors thesis in public health. And Dr. Prada, I'm fortunate enough to have her as my advisor. And so today we will be looking at abortion usage in the state of New York, and specifically examining factors that influence the abortion rate at the county level. So my goal with this talk today is to both tell you about my research and also convince you about why the abortion rate, specifically at the level of the county, is a really important public health indicator. And so just moving forward, I just want to say, feel free to interrupt me or ask questions or anything like that in case you want to see anything again. Awesome. So before I kind of jump into my research, I just want to talk a little bit about myself and give you an introduction into who I am and why I care about reproductive health outcomes in the United States. And one thing that you should know about me is that I'm really interested in early human development and in the factors that explain, that influence our ability to age in a healthy way. So I've done some basic science research in this is like a Drosophila embryo here, looking at how our genetics can influence our aging. However, I've also become really interested in how our social environment and how our access to healthcare can influence our ability to age in a healthy way. And a lot of this influence on me comes from my family background. So my family is from Finland, and I've seen a lot of my loved ones interface with the healthcare system and be able to age in a healthy way a little bit differently than some of my other friends and family here in the States. And so just an example of that is my aunt recently gave birth to my two little cousins who are, they're both 2 years old now. And when she gave birth, she actually was able to receive 7 months of paid maternity leave. And she was also able to receive support from well-run state programs during those 7 months so she could focus on her own mental health and on the health of her children. And so things like this have really impacted me and have motivated me to want to learn more about what influences reproductive health outcomes and how can we intervene to prevent negative health consequences. And so one way that I think negative health consequences or negative reproductive health outcomes can be improved is by using the abortion rate to study different populations of people. And so the abortion rate is the number of abortions per 1,000 women in a community. And when you average this over an entire calendar year, it's often referred to as abortion incidence. And so today we're going to be looking at abortion incidence at the county level. That is the number of abortions in a given county per 1,000 women living in that county, who are between the ages of 15 and 44, commonly referred to as like the reproductive age. And this information is really important because it's necessary to estimate accurate pregnancy rates, accurate rates of unintended pregnancy, and access to contraceptive care and family planning services. And so the abortion rate is really important specifically because it's a quantitative outcome that is directly tied to, unintended pregnancy and seeking an abortion as a result of that. Whereas other measures of trying to ascertain levels of unintended pregnancy and contraceptive use, they generally rely on surveys, and a lot of great research has been done using survey methods. However, this is subject to bias, and that's why a lot of public health researchers and policymakers are really concerned about the abortion rate to learn about differential risk for unintended pregnancy in different groups of women. And so another reason why the abortion rate is so important is because it's of course directly related to unintended pregnancy, which can have a lot of negative health consequences. So in women, unplanned pregnancy is associated with obstetric complications, receiving prenatal care later in your pregnancy, which can be harmful, and also higher levels of postnatal depression compared to women with planned pregnancies. And this is regardless of the outcome of the pregnancy. And then for children, unplanned pregnancy is associated with a lower birth weight, poor mental and physical health outcomes, and poor performance on cognitive tests. And so these negative health consequences in children are something that's really important for someone like me who is concerned about early development. And I think the abortion rate provides information that can allow us to intervene to try and reduce these negative health consequences. And so, as I've kind of alluded to a few times now, information at the sub-state level or at the level of the county is really important. And one reason why this is because there's not a lot of information currently about abortion incidents at the county level. And this is because the two main sources for this kind of information, the CDC and the Guttmacher Institute, each report abortions at the state level. So they'll report the abortion incidents for California, New York, Texas, but not for the individual counties within these states. And there's a lot of research that shows that there is variation in the abortion incidence within states. And so today, the research that me and Dr. Prada have been doing aims to implicate the factors that are associated with the variation in abortion incidence that we see at the state level. And currently, we really don't know much about these factors. And so the reason we're looking at New York State specifically today is because it has a very constant policy landscape related to abortion compared to other states. It's actually one of the most permissive states for abortion, with having had no new restrictions on abortion since 1970. Moreover, it has a law requiring the registration of all abortions, so this should lead to it having some good quality data by county. And finally, the Affordable Care Act was implemented in the middle of the study, which took place between 1997 and 2014. So it's important to note that New York State had already committed to expanding Medicaid and allowing Medicaid to cover abortions prior to the ACA. So if we had done this study in a different state, we would probably be worried about some secular trends related to the implementation of the ACA. However, New York State doing the study in this state kind of circumvents these challenges. Great, so I'll talk to you a little bit right now about the variables that we used in the study. So our main outcome of interest was abortion incidence at the county level. And we assembled data on abortions from the annual vital statistics, which are published by the New York State Department of Health. And we used these vital statistics to reconstruct a cohort of counties from 1997 to 2014 that we could follow forward in time. We also included age as a covariate to adjust for. And while we don't know the average age of each county, we were able to calculate the proportion of women aged 15 to 29, because this age group accounts for more than 70% of all abortions. So it's important to adjust for this. We also examined 3 predictors that we thought could explain the variation in abortion incidence at the county level. The first of which being prenatal care usage, which we defined as the percent of women in a county who receive no prenatal care or prenatal care beginning after 3 months in pregnancy. And this is important because it's directly tied to contact with health services, which is of course related to contraceptive access and risk of unplanned pregnancy. We also looked at unemployment, which is the percent of people in each county who are currently unemployed. And we obtained this data from the US Bureau of Labor Statistics. And finally, we looked at the poverty rate, which is the percent of women in each, or not the percent of women, the percent of people in each county who are currently living at or below the federal poverty level. And this data was from the United States Census Bureau. So one thing that's cool is that all the data in the study is from publicly available data sources. And while it is hard to have information on abortion incidence at the sub-state level, you have to do a lot of data cleaning. It's certainly possible just with public data sources. And so hopefully as efforts to examine the abortion incidence at the sub-state level expand, we'll see more data sets that have this kind of information. Great. And so we wanted to analyze, our research question was, are poverty, unemployment, and prenatal care associated with the overall abortion rate for the county level, as well as the abortion rate for different age groups, such as age group, the abortion rate specific to women aged 20 to 24, for example. And we adjusted, we did our analysis by linear regression. And in our models, we adjusted for age, as well as calendar year, as well as all of our other 3 predictor variables to try and obtain unbiased estimates of these measures of association. And specifically, we used mixed effects models. And these had fixed effects for county of residence. Because of course, one of the assumptions of linear regression is that your observations are independent. However, we had repeated observations of each county for each year. So we had to use something called fixed effects to correct for this. Great, so you can see here, this is one of the main results of this study, which is the trends in abortion incidence at the state level, subsetted by New York City and also by the rest of the state, excluding New York City. So just to kind of orient everyone, I know there's a lot of lines here, but the bold dashed line is the overall abortion rate, while the different colors correspond to the abortion rate for specific age groups. So you'll see usually that age groups corresponding to women younger than 29, between 15 and 29, generally have higher rates of abortion incidence compared to older women, which is something that we see at the national level. And you'll also see that at the state level, we saw a decrease in the abortion incidence over the study period, specifically by 51% from around 35 abortions per 1,000 women to around 23. And this is something that also mirrors trends that we see at the national level, specifically a decline in the abortion rate beginning as early as 1980. One thing I want to point out is that within the state, we do see a lot of variation already in the abortion usage, namely that it's much higher in New York City compared to the rest of the state. And New York City also experienced a much more rapid decline of 78% compared to the rest of the state, which experienced a decline of around 24%. And finally, I just want to mention that there were some disparities that we saw between different age groups, namely that in New York City, we saw a decrease in the abortion rate for every age group, whereas when excluding New York City, we saw that age groups over than 30 actually saw increases in the abortion rate over the study period. So this is one of the motivations for why we wanted to look at the abortion incidence for specific age groups in our linear regression analysis. Here are some descriptive statistics of the counties in New York State. So there's about 62 counties in total, with 6 of them being in New York City and the rest being in the rest of the state. And we calculated our descriptive statistics of our outcome as well as the predictors weighted by the population of women in the county. And so one thing here I just want to point out is that there is evidence for substantial variation in the abortion rate within New York State. We see a very high standard deviation of 17.5 at the state level. And when you exclude New York City from the analysis, we see that the standard deviation of the abortion rate is almost as high as the abortion rate itself. So clearly there is variation in the state, and it's important to look at the factors that are associated with abortion incidence so that we can better understand this variation and target efforts to the most urgent areas to prevent those negative health consequences that I talked about a little bit earlier. Great, so I first want to talk about poverty, which was the first predictor variable that we decided to look at. So on the left here, you can see the results from our linear regression analysis, and this is adjusting for unemployment, age, calendar year, as well as prenatal care usage. And you'll see that at the state level, the poverty rate was positively associated with the beta coefficient that we see for abortion incidence. Specifically, an increase in the poverty rate by 1% was associated on average with an increase in the abortion rate by 1.82 abortions per 1,000 women. Another thing that you'll notice is that the association is much stronger in New York City compared to the rest of the state. And I'll talk about why we hypothesize that is in a little bit. Finally, I just wanted to show here that these results show the beta coefficient for each of the abortion rates for specific age groups, subsetted by region. And you'll see that although at the state level, it's significant for every age group, we see the strongest associations among young women, specifically women less than 30 years old. And so why is this important, right? One thing is that we did expect to see a positive association between poverty and abortion incidence at the county level. And this is because abortion is becoming increasingly concentrated among poorer women. In 2010, in fact, 76% of abortions occurred among women living at or below 200% of the federal poverty level. And one reason why researchers think that this is that poverty is associated with unintended pregnancy through inhibiting access to contraception. So poor women not being able to afford contraception leads them to higher risk of unintended pregnancy and subsequent possible abortion. However, it's not that simple because poverty can also impede access to abortion because obviously abortion is a very expensive procedure that women in poverty may not be able to afford. And also, women in poverty face added difficulties when needing to get an abortion, such as having to travel long distances to get an abortion, having to take off time from work to get an abortion, or trying to find someone to watch one of your kids while you go to the abortion clinic. And so this second point is why we think there might be a much stronger association in New York City compared to the rest of the state. So this is again what I'm talking about here. We see that there's much higher positive association in New York City. And we believe that this might have to do with the higher density of abortion providers in New York City compared to the rest of the state. The state of New York overall, out of all the counties, 51% of them do not have an abortion provider. And all of these are located outside of New York City. So you could imagine a scenario in which the association for the rest of the state is confounded because many women may not be able or may have difficulty accessing an abortion because they need to travel longer distances compared to the women in New York City to receive abortion services. And so we believe that this is something that is important for urban versus non-urban areas. And the results of this study kind of inform possible future work that may want to look at if the association between poverty and the abortion rate is stronger in urban settings like New York compared to non-urban or more rural settings. Finally, I just want to reiterate that the associations were strongest among young women, and this highlights the importance of targeting contraceptive programs to young women, especially those who are facing the difficulties of poverty. Great. Next, I want to talk a little bit about unemployment, which is another predictor that we were interested in. And in this case, you will see that, again, this is the results of the linear regression analysis adjusted for all the predictors as well as age and calendar year. And we saw here that an increase in unemployment was associated with, on average, a decrease in the abortion rate by almost 1 abortion per 1,000 women at the state level and slightly less at the rest of the state. We had a null finding for New York City, which is pretty interesting. And I also want to say that the associations, there did not appear to be significant trends by age. because in both New York State and in the counties outside of New York City, we saw a significant association for all age groups. And so we did expect to see a negative association between unemployment and poverty. And this has a lot to do with previous research, which has showed that unemployment often leads to significant decreases in both overall fertility and unintended fertility. So, for example, couples who are dealing with unemployment may choose not to try and have a kid right now. They may like to wait until the economic conditions are better. And this is a big reason why births are down during unemployment. And as a result, abortions tend to be down as well. However, this decrease can also be explained by the fact that unemployment leaves people in worse financial situations, and this often prevents them, again, from accessing an abortion, similar to the effect of poverty. And so we saw this negative relationship, but it's kind of hard to tell what contributes to this, what's the relative importance of a decrease in births versus a decrease in access to abortion. And again, here we see that the decrease is a lot stronger in the rest of the state compared to New York City. And this might be explained by New York City providing better access to abortion services compared to the rest of the state. So New York City only sees the decrease associated with a decrease in births. And we did run a model that was where we removed prenatal care usage from the model. And so this unadjusted estimate was negative 0.7 compared, and this is for the rest of the state. So we saw a slightly weaker association, which generates a hypothesis that access to care measured by prenatal care can possibly ameliorate the effects of unemployment by increasing access to abortion. And so I've talked a lot about recently how unemployment affects the abortion rate through affecting the overall birth rate. And so that's why in future studies, it would be interesting to see, to kind of discern the causal mechanism that's working here by looking at what's called the abortion ratio, which is the ratio of pregnancies that end in abortion. And so this estimate is independent of a decrease in births associated with unemployment. And future research in that field may be able to tell us how unemployment is related to access to abortion. Finally, I just wanted to talk about prenatal care. And the reason that we looked at prenatal care is because we really wanted to have an estimate of access to care in our data set. And using the publicly available data sources, we thought that prenatal care usage would be the best one. So I just want to remind everyone that we define prenatal care usage as the percent of pregnancies that do not receive prenatal care or receive prenatal care late in the pregnancy. So a higher number here is associated with worse access to health services. And correspondingly, we saw that if you increase the percent of women who receive prenatal care late or don't receive it, you also see an increase in the abortion rate, which makes sense. So these results support the inclusion of this variable as a confounder to try and ascertain unbiased estimates of association for poverty and unemployment. And yeah, that's kind of just what I talked about a little bit earlier, how widespread health service contact is directly related to prenatal care usage. And thus, by adjusting for this, we can try and look at the effects of access to care on abortion, adjusting for poverty and unemployment. Great, so I'm going to talk a little bit about the limitations of the study now. So first of all, our unit of observation here was counties. So by definition, this was an ecologic study, and that means that it's pretty hard to implicate causal mechanisms between these factors in the abortion rate, even though we did see strong associations. And that's why a lot of our results have prompted even more questions and generated even more hypotheses. And we also use some non-specific predictor variables, namely poverty and unemployment, So for example, the poverty rate was the percent of people in a county that were living at or below the poverty level. However, it might have been, or it would have been better to have a poverty rate specific to women. And it would have been even better to have a poverty rate specific to women of reproductive age. So that's why these variables should be taken kind of with a grain of salt. Finally, one thing is that there could be unmeasured confounding here. I talked about distance to the abortion clinic being a potential confounder a little earlier, and that's just something I want to reiterate. And finally, even though we picked New York State for its ability to avoid secular trends, the abortion landscape is constantly changing, and attitudes and culture around abortion are always shifting. So our data does not capture these trends, and that's something that is a limitation of the study. And finally, I just want to conclude by showing that we did provide evidence that poverty and unemployment are important predictors of the abortion rate at the county level. And so they can be used to possibly inform programs targeted to different women, different age groups, to help combat the effects of unplanned pregnancy and to help increase access to contraception and family planning services. We also provided evidence that a high density of abortion providers may ameliorate the effects of unemployment and poverty on abortion access. So this was shown through the discrepancies between New York City and the rest of the state, as well as adjusting for healthcare access through prenatal care. Finally, I just want to mention that in New York, they recently passed a law called the Reproductive Health Act in 2019. And this is a law that is expected to greatly increase access to abortion moving forward. And so it will be interesting to see how this affects abortion incidence at the county level. And it may affect the associations that we measured here going forward. And I just want to say that this work, we saw that poverty and unemployment are associated with abortion incidence. And that's just one example of how the circumstances in which abortions are sought often drive abortions themselves. And there's currently a sustainable development goal of reducing the abortion rate. However, we all know a lot of restrictive states are trying to do this by restricting access to abortion to decrease the abortion rate. But hopefully this research reiterates the importance of instead reducing the circumstances in which abortions are sought to meet this goal of reducing the abortion rate. I just wanted to say thank you so much to my advisor, Dr. Ndola Prata, for all of her support over these past few months and for imparting a lot of wisdom on me and for helping me every step of the process. And thank you so much to Kate Pennington for helping inspire me to start this project and helping me understand the importance of the abortion rate at the county level. Thank you so much for listening to my presentation. And if anyone has any questions, I'd be happy to answer them or have a discussion.
Marcus, that was amazing.
I know.
I cannot believe the amount of data that you were looking at and analyzing. And this for your MPH thesis?
This is for my thesis and the
undergrad
public health major.
I cannot believe it. That's why I was like, I thought it was an undergrad, but then I didn't want to say undergrad because I'm like, there's no way there's an undergrad doing this work.
Yeah, that's Marcus.
Wow, I am so impressed, and I feel like I have so many questions. But I'm still thinking about everything. But the one, I'm from New York originally, Western New York, so now I'm in the other part of the state. And I could not believe that 51% do not have abortion providers. I mean, we think of New York as like kind of a poster child of services. So I think that in itself was really surprising. And then in the beginning, I'm not familiar. You said, so abortions were funded through Medicaid and ACA. So the funding in New York?
Oh, sorry. So the point I wanted to make there is that New York, they had already committed, so Medicaid already covered abortion prior to the ACA, which if you've heard of the Hyde Amendment, that prohibits federal funding from being used to finance abortion. Yeah, so New York actually went ahead and used Medicaid to finance abortion anyways, but because of that, they get less funding from the federal government.
Okay.
Oh yeah, and just one other thing about the 51% number. So yeah, it is true. That was from 2011, that 51% of counties did not have an abortion provider. However, what you said about how surprising that is also makes sense because only 8% of women live in a county that does not have an abortion provider.
Oh, that's interesting.
So the smallest counties also tend to be ones that don't have providers.
Okay, that makes sense. Yeah, I'm still trying to like wrap my brain around, like I was surprised to see the results for unemployment where, and like, it was interesting because you brought up fertility goes down but I'm also like, yeah, but that assumes like so much more planning around kind of when you get pregnant and then a need for abortion. So then I'm like, does sex go down during unemployment? I don't know. So it looks like you have next steps with that, which I'm really excited to see.
Mm-hmm.
And so I'm just wondering if you have any more thoughts, like when you've been thinking about kind of what's going on with like the different trends with poverty versus unemployment. I was expecting to see similar trends.
Mm-hmm. Yeah, that definitely makes sense because both are kind of associated with, having less money to like finance like contraceptives and abortion and all these things related to reproductive health. But it is interesting because they affect both your risk of unplanned pregnancy, but they also affect how you respond to pregnancy or your autonomy, I guess. So I think that's one thing that's interesting is that unemployment, especially with recessions, we see a lot less births. And this is something that Kate's working on with her research, where she's looking at how unemployment affects abortion across all the states. And so you can kind of discern the relative contributions of unemployment to both impeding access and also decreasing births that way. So yeah, it's a rigorous research question, I guess.
Also, unemployment in this particular case for this study, sort of at one point in time. So, like in different years could be different people. It could change much faster than, for example, getting out of that below poverty line.
Yep, I think that's a really good point. And that actually might be something like as you're writing it up, like context around that as well, because unemployment changes a lot more where it's a lot harder to get out of that above the poverty level. That's a really interesting point. Everyone else should ask questions before I make any more comments, but I do want to say that this was like really, really impressive research. And I want to commend you for the work that you've done, and hopefully CT can put this up on our YouTube with your permission, because I'm sad that there's not more people seeing this right now. I think it'd be really inspiring for other undergrads to see what you're doing.
Absolutely. Yeah.
Oh, that's so nice of you to say. Thank you.
Yeah.
Just to chime in on.
Go ahead,
sorry,
Kate.
Go ahead, Ndola.
Oh no, I was just saying that we will sort of try to publicize a little bit more, because it's really, I want to excite people to look at data by county and to explore some of, even though it's an ecological study and it has sort of the ecological fallacy, but it's still important to look at data by county.
Yeah. I was going to add one other sort of way of framing some of the considerations about how something like poverty or unemployment might affect abortion. So, it could be simultaneously affecting people's fertility preferences and affecting their access to reproductive healthcare services. And it's really hard to tease those two things apart. But thinking about how both of those things might be changing at once, I think can help sort of frame an understanding of maybe surprising patterns of results there. And then I just also wanted to say congratulations, Marcus. This is such a fantastic project. And it's so cool for me to have gotten to see it, from its very beginning all the way through to this point. And it's been such a pleasure working with you over the last few months. And I'm really excited to see what comes next.
Thank you, Kate. I couldn't have done it without your support too. So it was very fun. And yeah, thank you for mentioning that about poverty and unemployment. It's certainly interesting how they can have you see kind of like an equilibrium between the effects that they have relating to like reproductive health decisions as well as access that you said.
Mm-hmm. And then like so many people in the United States, their insurance and access to services through their job. So I was, if no one else has another question, I was wondering like what other confounders you had mentioned distance to abortion provider, but what if other ones you thought were affecting your results?
Yeah. So that was definitely, that's a great question. And that was one of the main things that is really important, distance to an abortion provider. And I think that's something that a lot of research that's right now is focusing on. And I think that's something that Kate is interested in. Another thing is that there's a lot of, I think at the county level, it might be hard to look at other factors, but of course, maybe just some more things related to demography,
Mm-hmm.
such as like, just race, things like that. Because in New York City, especially, it has one of the greatest like income inequalities out of any city in the world, and also has really strong segregation by neighborhood, by race. And so, these are things that can kind of confound our analysis, especially for New York City. But of course, there's a lot of other things that really go in to the abortion rate. Like, some woman may have like an abusive partner who wants them to get an abortion or not get an abortion. And it's really hard to capture these things at the county level. And so that's where like these survey-based methods that work with like a study group of individuals can really ascertain those things.
Mm-hmm. Mm-hmm.
Mm-hmm. And another thing, Marcus, is that so, for example, that's unemployment rate of the county,
Mm-hmm.
right? But we don't have, for example, unemployment rate of this group of women that are getting abortions, for example, or because it would be a little bit more refined if we have, and also if we had for their partners.
Mm-hmm.
Mm-hmm.
Because when the decision happens to terminate the pregnancy, it's like both have to be unemployed or one is unemployed. I mean, I'm not talking about partners that they have to live in the same house, but if you're gonna co-parent in the future, sort of what is the sort of the baseline in terms of that the couple starts with in terms of who needs to be working. Both need to be working or just one, and if one, who will be?
Mm-hmm. Yeah, it's very interesting. It's like one question leads to another, it seems.
Yeah. That's the beauty about research.
But I hope you're planning to write these results up and eventually submit for publication.
Yeah, hopefully. Right now I'm just focusing on writing my honors thesis with Ndola. So that's been really fun, like my first time doing scientific writing like that. And yeah, we'll see where it goes.
Well, she's like the queen of publication, so you're in good hands.
Oh, great.
Karen just gave me a new title.
Yeah, I don't know. I just think like, yeah, it's just really important. I keep thinking about New York and then thinking about other states where there's even less access and just like, oh my goodness, seeing these results. And then you think about Louisiana or Mississippi. So it's important work.
Mm-hmm. Mm-hmm.
Yeah, that's interesting that you brought that up because there is some other research that looks at abortion incidence at the county level. However, this research has been in those kind of states that you just mentioned, like Texas, Louisiana, Ohio, and it generally looks at the effects of different policies, like trap laws, for example,
Mm-hmm, mm-hmm.
and how that affects the abortion incidence. But it's less concerned with, like overlying like structural factors at the state level.
Mm-hmm. Mm-hmm. Yeah. Well, thank you. I don't know if I'm not even sure what time it is.
We still have a few minutes if you have more questions.
I don't think I do. Let me see if I have any. I guess, so I'm wondering, obviously you started looking at all of the counties. What did you say? There were 61, 62? And then how did you decide to then group by New York City, the counties in New York City versus the rest of the state? And did you get more granular with really looking at each county?
Yeah, that's a great question. I probably should have mentioned that earlier. So one reason why all the data is kind of split up by the state level and then the city level and the rest of the state is because for abortion incidence reporting for like the Guttmacher and CDC, the rest of the state is actually separate from New York City just by convention, because New York City actually generally has more abortions overall than the rest of the state. So they're kind of treated a little bit separately just for that reason in other literature. And then for some things, we did see that New York, if in the overall analysis, you'd see the association is really strong. And that's because, New York City will generally have like very high poverty and very high abortion rate, kind of pulling everything up. And same for unemployment. So it's just something that we wanted to correct for. And also, like I said, there's a huge difference in like the density of abortion providers in the two areas. Mm-hmm. So I think it's important to look at them both separately and together, and to see if there's some interaction between like region being city or rest of the state versus the poverty or the abortion rate. Sorry.
Mm-hmm, mm-hmm. That makes sense. Yeah. I don't think I have any other ones. I don't know.
Okay, thank you so much for your questions, though. They were really interesting.
Yeah, no, I mean, I feel like this has made me think so much about a lot of things. And I know you had mentioned race as a confounder, and, we often don't want to look at race unless we have a hypothesis of why there would be race differences. I think that there'd be a pretty good case in your research because we've seen a lot of race differences in abortion rates. So it might be interesting to look a little bit more into that as well.
Mm-hmm. Yeah. The other thing I was thinking, Marcus, for the publication, we could actually, so we have the graphs by age. And
see, she's already thinking about the publication.
The decline, but it will be good to have sort of a map with the counties,
mm-hmm.
right? With the color-coded, by thresholds of abortion levels.
Mm-hmm.
So one for the beginning of the period and one for the end of the period, so you can see how the color change. And it will be a good visualization for how abortion has changed there.
Mm-hmm.
Yeah, I agree. That would be a lot easier to look at than me just being like, the standard deviation is 13.
Right, because the problem is like the table for the 60-something counties is so long, and mm-hmm. with all of these different rates, it's hard to capture I think in a map it will be probably easier.
Mm-hmm. I think so too. Yeah. And did you say, so in the beginning, I remember you showed, once you broke it out, that actually for the older groups of women, and I think it was the rest of the state went up slightly, right?
Mm-hmm. Yeah, it did.
So did you have any thoughts on that?
I don't know. I think it might be important for older women to like access to abortion might be more important for older women because they might have children, or they're more likely to have a job than like a 15 to 17-year-old. And so living in like a non-urban area where you're generally further away from an abortion provider may explain that, but that's just off kind of the top of my head.
Mm-hmm. No, that's,
but yeah.
And you can see, I mean, I'm kind of zooming in with my eyes here, but like in New York City, those like pretty steep drops are kind of, it's like right around the Great Recession, right? Like right after everything fell in 2008, was it?
Right, yeah, 2000 2007 to 2009, I think.
Yeah.
Kate, is that correct? Was that when the recession
I
was?
know. I'm like, I should know this.
Yeah, so the recession years would have been 2007 to 2009. So you'd expect, if there were unemployment effects or something, you'd expect them to start, I guess, like
Yeah.
a couple of months after people were hit by the recession, so a little lag.
Yeah, interesting. All right, I will stop talking because there are so many interesting things. I can't wait to see. Maybe you can do another update at some point once you keep working on if you do your next steps like you're hoping. I know sometimes there's not always time, but I'd love to keep seeing your updates as you work through this.
Oh, thank you. I really appreciate that. And yeah, I'll definitely try and share my updates if we can do anything like that. Especially, it might be cool to see the map, so I can try and put that out somewhere.
Great.
Okay, well, thank you so much, Marcus. This is fantastic work that you did.
Thank you so much for giving me the opportunity to present today. I really appreciate it.
Yeah, and great presentation skills too.
Exactly. You explained really very well everything.
Thank you, Marcus.
All
Thank
right.
you, CD, for hosting.
Class.
Thank you. Thank you.